Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. This week, we will again be discussing major developments and events over the past 7 days in the Middle East region across healthcare, public health, life sciences, and wellness. As always, you will hear trends, insights, and the latest developments across the Middle East region for the week leading up to September 11, 2025. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. Healthcare policy and government initiatives is our first topic. Saudi Arabia mandating insurance in public care. In a major health financing reform, Saudi Arabia's Council of Health Insurance has required all government healthcare facilities to contract with health insurers, effective July 2025. This new rule means public hospitals and clinics will bill through insurance, bringing them into the kingdom's emerging insurance-based system. By integrating public providers with insurers, Saudi aims to boost efficiency and prepare for broader mandatory coverage. The move is a cornerstone of Saudi health transformation under Vision 2030, shifting the state from sole provider toward a regulated insurer model. Officials note that it should expand private sector participation and improve financial sustainability of public services over time. UAE Holistic School Health Program. As the academic year began, the UAE unveiled an integrated national plan to elevate student health in schools and universities. Emirates Health Services, EHS, announced it now oversees 333 dedicated school clinics across 312 public schools nationwide, staffed by medical and nursing teams. Under the plan, new preventive screenings target different age groups for early disease detection, and school health staff are receiving specialized training in first aid and emergency response. EHS also rolled out a back-to-school health guide for families with tips on nutrition, hygiene, and safety. The strategy puts an emphasis on vaccinations. Over 95,000 students were immunized via school clinics last year, and wellness education to instill healthy habits. UAE health officials described this effort as creating health-first learning environments. By strengthening the link between healthcare and education, the UAE hopes to improve youth well-being and long-term academic outcomes. Egypt ongoing crackdown on illegal clinics. Egyptian authorities this week continued a nationwide sweep against unlicensed and unsafe medical facilities. Following last month's high-profile closures of 16 rogue addiction treatment centers in Cairo, the Ministry of Health intensified inspections in other governorates. Numerous private clinics and labs lacking proper licenses or with unqualified staff were shut down and referred to prosecutors. Officials stressed that patient safety is paramount and vowed to leave no room for violators. This enforcement push aligns with Egypt's broader efforts to regulate health services and protect patients from malpractice. In parallel, the government has been investing in upgrades at public hospitals, more on that later, to ensure citizens have access to safe, quality care, reducing the demand for dubious providers. By clamping down on illicit clinics while improving legitimate facilities, Egypt aims to restore trust in its healthcare system. Bahrain preparations for national insurance. Bahrain is in the advanced stages of rolling out its landmark Sehati National Health Insurance Program, reform slated to assure basic coverage for all citizens and residents. This week, officials reported progress on final regulatory steps and stakeholder training before full implementation. Notably, since early 2025 all private employers have been instructed to secure health insurance for their workers. Under Sehati, Bahrain will offer a government-funded base package and allow citizens to choose between public and private providers, while expatriates will have mandated private insurance. The Supreme Council of Health has emphasized that Sehati goes hand-in-hand with new digital health integrations, such as a national patient registry and health information exchange, enabling a more coordinated, population health approach to managing chronic diseases. By fostering competition and optimizing resources, Bahrain expects the insurance program to improve healthcare quality and equity, while its parallel digital upgrades enhance efficiency. The holistic vision is to create a sustainable health system where financing, data, and service delivery are all aligned for better outcomes. Next is life sciences and research innovation. Israel, first human spinal cord implant. Israeli scientists are on the verge of another world-first biomedical milestone. Tel Aviv University announced plans to perform the world's first human spinal cord transplant, using lab-grown tissue derived from a patient's own cells. This groundbreaking regenerative therapy, essentially implanting an engineered spinal cord, is aimed at enabling paralyzed patients to walk again. Researchers have spent years developing the technology, including successfully growing functional spinal cord tissue in the lab. The upcoming surgery, a clinical trial in Israel, will mark a historic moment in regenerative medicine. If successful, it could open doors to new treatments for spinal cord injuries, offering hope to millions worldwide. The trial underscores Israel's role as a biotech innovator. It comes on the heels of other advances like last month's report of an Israeli team growing a human kidney organoid to late gestation equivalents, another world first, together solidifying Israel's reputation at the cutting edge of stem cell and tissue engineering research. Global scientists are watching closely, as these breakthroughs could revolutionize transplant and injury repair medicine. Saudi Arabia elevating biotech on the global stage. Saudi Arabia is intensifying efforts to become a regional and global biotechnology hub. The Ministry of Health recently launched the first-ever BIO Middle East Conference, a major event dedicated entirely to biotech, to be held in Riyadh in May 2026. Announced on September 10, this planned gathering, part of the Global BIO series, underscores Saudi's commitment to life sciences leadership. Health Minister Fayed Al-Jalajel hailed the event as a significant milestone as the kingdom establishes itself as a global hub for biotechnology and life sciences innovation, aligning with Vision 2030's goals. Beyond events, Saudi's National Biotechnology Strategy, launched 2024, is driving concrete initiatives. The kingdom is investing heavily in R&D infrastructure, regulatory fast tracks, and talent development to attract biotech companies. At the BIO Boston conference this summer, Saudi's delegation invited international partners to come build with us, highlighting streamlined clinical trial approvals, cut by 60% in time, and new incentives for innovators. The message is clear: Saudi Arabia is open for biotech business. Through hosting high-profile conferences and fostering a supportive ecosystem, it aims to catalyze breakthroughs in vaccines, genomics, biomanufacturing, and more on its soil. These moves not only diversify the economy but promise to bring advanced therapies to the region's patients faster. Next we will talk about biotech and pharmaceutical developments. Abu Dhabi Global Pharma Partnerships. The UAE continued to strengthen its position as a pharma innovation hub through strategic alliances. The Department of Health, Abu Dhabi, DUH, has signed a series of memoranda of understanding with leading global drug makers to boost local R&D and manufacturing. Over the summer, DUH inked deals with Sanofi focused on accelerating the development of new vaccines and Boehringer Ingelheim aimed at fostering cutting-edge research projects in the Emirate. Under the Boehringer partnership, formalized during a U.S. visit in June, Abu Dhabi researchers will gain access to the company's advanced OpenMe drug discovery platform and training opportunities. The Sanofi Alliance, signed at BIO 2025, will leverage Abu Dhabi's health tech ecosystem to shorten the timeline from early vaccine research to public availability, for example by using AI, real-time data, and parallel trials to speed up development. Both partnerships underscore Abu Dhabi's broader vision of becoming a regional life sciences powerhouse. By streamlining regulations and investing in state-of-the-art infrastructure, the UAE is attracting top pharma firms to collaborate. The expected payoff: homegrown capacity in vaccine production, greater clinical research activity, and earlier access to innovative therapies for Middle East populations. Saudi Arabia, Jordan, first MENA biologics factory. The Middle East's drive to localize pharmaceutical production saw a landmark achievement with the opening of the region's first biologics manufacturing facility. Oman-based MS Pharma inaugurated a $50 million state-of-the-art plant in Riyadh, Saudi Arabia, equipped with formulation, fill and finish, and freeze-drying capabilities for advanced biologic medicines. Specializing in monoclonal antibody therapies and other complex biologics, the Riyadh site is the first in MENA to meet stringent Saudi FDA, SFDA, European EMA, and US FDA quality standards. This facility will produce biosimilar versions of high-cost biologic drugs, including treatments for autoimmune and neurological diseases, in partnership with international developer Pharma Biologics. By performing final manufacturing steps locally, the region can greatly reduce costs and improve supply security for these life-saving therapies. Executives noted this is a milestone for regional self-sufficiency, positioning MS Pharma as a MENA leader in biotech production. It also supports Saudi's strategy of becoming a biopharma export base and aligns with Jordan's growing pharma industry expertise. Overall, the project exemplifies how regional collaboration and investment are transforming the Middle East from an importer to a producer of sophisticated pharmaceuticals. Egypt, building vaccine self-reliance. Egypt took further strides toward vaccine self-sufficiency under a new trilateral partnership signed at the end of August. State-owned vaccine maker Vaxera entered an MOU with the UAE's G42 healthcare investment arm and China's Sinopharm Red Flag Biotech to expand domestic production of human and veterinary vaccines, as well as develop plasma-derived therapies. Officials lauded the deal as strategically positioning Egypt as a regional manufacturing hub for vaccines serving African and Arab markets. It will bring in foreign investment and technology transfer to upgrade VACSEI's facilities and know-how. In practical terms, Egypt plans to locally produce a larger portfolio of routine immunizations, like influenza, hepatitis, rabies vaccines, and build a plasma fractionation plant to make blood plasma products, for example immunoglobulins, reducing reliance on imports. The partnership also envisions joint research on new vaccines. Egyptian health leaders emphasized that boosting domestic production capacity is crucial for national health security, a lesson reinforced by COVID-19. With a population of 105 million, Egypt is by far the Arab world's largest vaccine market, so these efforts will not only meet local needs but potentially supply neighboring countries. While it will take time to realize, the alliance marks a major boost to Egypt's biotech ambitions, advancing President Sisi's directive to achieve 100% self-produced vaccines in the coming years. Public health challenges and disease outbreaks is what we will dive into now. Gaza, famine and disease crisis. The humanitarian health emergency in Gaza showed no respite. Local health officials reported that 185 Palestinians died from hunger in August alone, as the wartime blockade pushed parts of the territory into famine. This brought the total hunger-related death toll to 361, including 130 children, since the war began, a number expected to keep climbing. Malnutrition is skyrocketing. Nearly 1 in 5 children under 5 in Gaza City is now acutely malnourished, triple the rate in June. Hospitals, already short on food and medicine, are now overwhelmed with severely wasted children and pregnant women suffering complications from hunger. At the same time, Gaza is battling an unprecedented outbreak of Guillain-Barré syndrome, GBS, a rare paralysis causing disorder linked to post-infection complications and poor sanitation. 94 GBS cases have been documented since June, previously almost unheard of in Gaza, with at least 10 deaths. The World Health Organization warns it has run out of critical supplies needed to treat GBS. Gaza's stocks of IVIG immunotherapy and plasmapheresis filters are exhausted, leaving doctors with no treatment options for new cases. Health experts tie the GBS surge to deteriorating water and sanitation. Overcrowding, contaminated water, and collapsing waste systems are fueling infections that trigger the syndrome. With tens of thousands of children chronically undernourished and disease outbreaks spreading, Gaza's health system is on the brink of total collapse. Local authorities plead for an end to the blockade and immediate delivery of food, fuel, and medical supplies to prevent a further catastrophe. Aid to Gaza's health sector. As Gaza's crisis deepened, regional neighbors continued to send relief. This week the United Arab Emirates dispatched 5 additional humanitarian convoys through the Rafah crossing carrying desperately needed medical supplies and food. In total, 100 UAE trucks delivered over 2,376 tons of aid to Gaza's hospitals and shelters. The shipments, part of the UAE's ongoing Operation Chivalrous Night 3, included donated medicines, for fluids, ventilators, dialysis machines, and other life-saving equipment consigned to WHO for distribution. They also brought staples like flour, rice, and powdered milk to combat acute malnutrition. The aid convoys exemplify regional solidarity. The UAE, Qatar, Egypt, Jordan, and others have all sent relief to Gaza over recent months, even as access remains tightly restricted. Health officials in Gaza expressed gratitude but note that needs still far outstrip the trickle of supplies entering. The WHO has called for sustained, large-scale shipments to flood Gaza with food and medicine in order to avert mass deaths. In the meantime, each convoy that arrives provides a brief lifeline, resupplying exhausted ICU stocks, restocking blood banks, and giving hungry families another day's sustenance. Cholera in Yemen and Sudan, fragile states in the region continue to battle major cholera epidemics. Yemen remains the world's largest cholera hotspot. By late 2024 it accounted for 35% of all global cholera cases and 18% of related deaths. In 2025, the water and sanitation crisis amid Yemen's protracted conflict has kept transmission extremely high. Millions have been sickened over the past few years. Aid agencies warn that without greater international support to restore clean water systems and rehydrate patients, Yemen could face yet another uptick heading into its rainy season. Meanwhile in Sudan, a nationwide cholera outbreak is unfolding in the chaos of civil strife. From January through mid-August, Sudanese authorities reported nearly 48,800 cholera and acute watery diarrhea cases and over 1,000 deaths across all 18 states. The majority of infections have hit the capital Khartoum and a few other provinces, but by now every single state in Darfur has confirmed cholera spread as well. Response efforts are hampered by insecurity, mass displacement, and the breakdown of health infrastructure after months of fighting between rival forces. Humanitarian groups have flagged a high risk of the Sudan outbreak exploding further due to difficulties in delivering supplies like for fluids, chlorine tablets, and vaccines. These parallel cholera crises in Yemen and Sudan highlight how conflict can rapidly reverse decades of progress in disease control. They also underscore an urgent need for diplomacy and aid. Without an end to violence and a massive scale-up in water sanitation interventions, cholera will continue claiming lives in the Middle East's most vulnerable populations. Next we have wellness and health promotion. UAE, Summer Without Accidents, wrap-up. The UAE concluded its seasonal wellness campaign, Summer Without Accidents, which ran through the hot months to promote public safety and health. Jointly led by the Ministry of Health and Prevention and Ministry of Interior, the nationwide campaign deployed field teams to educate communities on preventing common summer hazards. Topics included road travel safety, e.g. taking breaks on long drives, heat stress prevention, hydration and avoiding leaving children or medicines in cars, and basic first aid. Officials reported positive engagement, with many motorists and families pledging to adopt safer habits. By encouraging simple precautions, the campaign aimed to reduce traffic injuries and heat-related illnesses, aligning with the UAE's National Strategy for Wellbeing 2031 and its vision of a prevention culture. Initial indicators are promising. Preliminary data showed a modest drop in summer traffic accidents and emergency heat exhaustion cases compared to last year, which authorities attribute in part to heightened public awareness. The campaign's success has prompted planners to consider similar drives during other high-risk periods, as the UAE continues emphasizing preventive health measures to ease the burden on its healthcare system. Regional observance. Arab Health Day. Middle Eastern countries joined together on September 4 to mark Arab Health Day, an annual commemoration of the founding of the Council of Arab Health Ministers. Across the region, health officials used the occasion to celebrate frontline healthcare workers and reaffirm commitments to Arab world cooperation in health. In the UAE, the Frontline Heroes Office issued a message praising the dedication of doctors, nurses, and medical staff, the backbone of our health system, and highlighted how UAE medical teams have even provided aid abroad, such as supporting Gaza's hospitals during the crisis. Several Gulf ministers called for more knowledge sharing between Arab countries to tackle common challenges like non-communicable diseases. In Jordan and Egypt, public statements on Arab Health Day emphasized investing in healthcare quality and accessibility as a collective Arab goal. The spirit of the day underlined regional solidarity, that improving health outcomes in any one Arab nation benefits all, through better pandemic preparedness, economic productivity, and social stability. Moving forward, leaders proposed reviving joint initiatives under the Arab League's Health Committee and expanding training exchanges for healthcare professionals. Arab Health Day thus served not only as a moment of reflection on progress made, but also as a rallying point for closer collaboration toward a healthier future for all Arab communities. Mental health and lifestyle initiatives. Governments continue to integrate mental wellness and healthy living into their public agendas. In Saudi Arabia, the Ministry of Health this week gave updates on its Quality of Life program, a sweeping initiative under Vision 2030 that treats mental and social well-being as national priorities. Dozens of new sports centers, public parks, and recreation facilities have opened across the kingdom in the past year, providing outlets for physical activity as part of preventive healthcare. The MOH is also expanding community mental health clinics and telecounseling services to reach people in need early. Preliminary figures show an uptick in Saudis utilizing these services, suggesting reduced stigma and better awareness. Similarly, the UAE's Year of Sustainability has spawned a series of community wellness events, from group fitness challenges to healthy cooking workshops, emphasizing the link between a sustainable lifestyle and personal health. In the Emirates of Abu Dhabi and Dubai, local authorities reported strong participation in recent family wellness days that offered free health screenings, yoga sessions, and nutrition consultations. Other countries are following suit. Oman just announced plans to incorporate stress management and healthy diet education into its primary care visits, and Kuwait is launching an anti-obesity media campaign targeting youth this fall. The common thread is that Middle Eastern health leaders increasingly view wellness and prevention as strategic priorities, not add-ons. By encouraging exercise, work-life balance, and mental well-being, they aim to improve quality of life and curb the rising tide of chronic diseases in the long run, complementing the traditional focus on curative services. Always fascinating is our next topic: digital health innovation. UAE HealthConnect Digital Health Expo, the region's burgeoning health tech scene, took center stage in Dubai, which hosted the first ever World Health Expo Tech, HealthConnect 2025 from September 8 to 10th. The event drew more than 5,000 healthcare leaders, 200 speakers, and 300 exhibitors from 30 countries to the Dubai World Trade Center. Under the patronage of UAE health authorities and in partnership with HIMSS, the expo highlighted AI advancements, telehealth, interoperability, and digital transformation across healthcare. Dubai's various health entities showcased dozens of innovative projects. For example, the Dubai Health Authority demonstrated its new AI literacy program, ALIF, for clinicians, a patient journey mapping system to streamline hospital workflows, and a pilot using smartwatches for blood pressure monitoring, all initiatives improving patient experience through tech. Startups from the region also featured solutions like AI-driven radiology diagnostics and app-based chronic disease management platforms. A key theme was investment in health technology. Panelists noted that Middle East digital health funding has surged and governments are actively supporting e-health entrepreneurs. The WHX Tech Expo's strong turnout underscored the Middle East's emergence as a global player in digital health, with Gulf states in particular eager to adopt and export smart health solutions. Bahrain. Toward a unified e-health system, Bahrain accelerated its push for a national integrated digital health platform. Building on the successes of its iSeha electronic health records and the Sehati patient app, the government is now developing the Digital Health Information System, DHIS, to link all public and private healthcare providers. Officials envision the DHIS as a one-stop platform where a patient's records can be shared seamlessly between hospitals, clinics, pharmacies, and insurers, improving care coordination and eliminating redundant tests. This week, Bahrain's cabinet reviewed an update on the project's rollout, which is scheduled to begin phase-wise implementation in 2026. Once in place, doctors will have instant access to patients' history, with consent, allowing faster, data-driven decisions and fewer medical errors. The Health Ministry projects significant cost savings too, potentially millions of dollars saved by avoiding duplicate procedures and optimizing prescriptions. Bahrain has been a regional leader in e-health. Its COVID-19 Be Aware app was among the first to integrate contact tracing with vaccination booking, and it has even chaired meetings to craft a broader Arab digital health strategy. By institutionalizing a unified digital health network at home, Bahrain aims to set an example for neighboring countries. The ultimate goal is a GCC-wide interoperability framework so that, for instance, a Saudi or Emirati patient's records could be accessed if they fall ill in Bahrain, and vice versa, truly connected care across borders. Telehealth as permanent expansion. Across the Middle East, telemedicine and health apps that surged during the pandemic are becoming permanent fixtures in healthcare delivery. In Saudi Arabia, the government's Sehati platform has facilitated millions of virtual doctor consultations, prescription refills, and lab result views, leading the health ministry to continue investing in the app and related telehealth services. Remote areas of Saudi, which historically suffered limited access, are now better served via teleclinics and mobile health units connected to specialists in Riyadh. The UAE likewise reports sustained high utilization of its digital health services. Dubai Health Authority's Smart App and Abu Dhabi's Malafi HIE have integrated features like specialist teleconsults and home medication delivery, which patients have grown to appreciate for convenience. Qatar's Public Primary Care Corporation noted that video mental health consults remain popular, so it is planning to permanently staff a telemental health unit beyond COVID-era needs. Meanwhile, hospitals from Kuwait to Oman have introduced AI-driven chatbots on their websites to handle routine patient queries and triage, freeing up staff time. This week saw no single big telehealth launch, but collectively the trend is clear: the region is mainstreaming virtual care. Governments are drafting standards for telemedicine licensing and reimbursement to integrate it fully into the health system. Experts predict that within a few years, 20 to 30% of all outpatient visits in GCC countries could be done remotely, improving efficiency and patient satisfaction. The digital revolution is breaking down barriers of distance and time, delivering care to Middle Eastern patients whenever and wherever needed. Hospitals, which we will discuss now, had a number of key developments. Saudi Arabia: new hospitals on track. Saudi Arabia is steadily advancing its massive healthcare infrastructure expansion. The Health Ministry confirmed that 5 new public hospitals are on schedule to open by 2025 across various regions, adding nearly 1,000 hospital beds in total. These include a major general hospital in Riyadh, a specialist women's and maternity hospital in Makkah, and new regional hospitals in Hale, Asir, Rijal Alma, and the southern province of Daran al-Janoub. Notably, a dedicated mental health and addiction treatment hospital is being built in the capital, addressing a vital service gap. This project was earlier announced and is nearing completion. These investments are part of a colossal SAR 260 billion development program in health and social care. During the week, Saudi officials emphasized that expanding capacity is essential as the population grows and ages. Once operational, the new facilities will significantly boost access in underserved areas, bringing advanced services like oncology and cardiology closer to remote communities. Additionally, dozens of smaller projects, new primary care centers, renal dialysis units, and emergency departments, are in progress kingdom-wide. By engaging private construction firms and public-private partnerships, Saudi Arabia is accelerating timelines on these builds. The commitment to infrastructure goes hand in hand with its workforce Saudization in health, ensuring the new hospitals will be staffed by qualified Saudi professionals. Overall, despite economic headwinds, Saudi health infrastructure development appears to be full steam ahead, keeping Vision 2030 health goals in focus. Egypt upgrading public hospitals. Egypt reported further improvements under its ongoing 100 Days of Health initiative, which has poured resources into revamping public hospitals and clinics. In the past 2 months, the Health Ministry installed new CT scanners, MRI machines, and digital X-ray units in at least 15 government hospitals located in high-need governorates. For example, large general hospitals in Gaza and Caliubia each received a 128-slice CT and 1.5T MRI, greatly enhancing diagnostic capability. Meanwhile, an emergency department expansion at Cairo's busiest trauma hospital was completed, adding more ICU beds and modern ventilators. As part of raising care standards, multiple Egyptian hospitals are also undergoing accreditation processes to meet Joint Commission International (JCI) quality standards. During a site visit this week, the Minister of Health noted that 2 flagship hospitals in Alexandria have nearly finished the required upgrades in infection control and patient safety to get JCI certification, a first for public facilities in Egypt. Additionally, Egypt's universal health insurance system rollout is bringing new facilities online. The government just opened 2 brand new hospitals in South Sinai, in Dahab and New Weba, and is preparing to launch UHIS services in Aswan by July 2025. These steps all aim to strengthen Egypt's hospital system capacity and quality of care. The 100 Days campaign has so far provided 77 million free medical services in its first 53 days, a reflection of both the high demand and the expanded throughput from these hospital upgrades. Officials acknowledge challenges with doctor shortages and maintenance, but the trajectory is positive. Egypt is determined to elevate its public hospitals to better serve the 100+ million population. Qatar Community Urgent Care Expansion. Qatar's primary healthcare corporation, PHCC, continued to broaden its network of urgent care services. Following several recent openings, PHCC announced that Al-Wajba Health Center now hosts a new urgent care clinic for adults and children, which began operations on August 28. This brings the number of PHCC urgent care units to 13 across Qatar, distributed in health centers nationwide. These clinics operate evenings and weekends to handle non-life-threatening but urgent medical cases such as minor injuries, fevers, and asthma attacks, thereby relieving pressure on hospitalers. The Al-Wajba Clinic, for instance, is open 3 p.m. to 11 p.m. on weekdays and 24/7 on weekends, staffed by general physicians and pediatricians with on-site pharmacy and basic lab radiology. In its first week, dozens of patients who would have otherwise crowded Hamad Hospital's emergency department received timely care in the community setting. Qatar's experience shows the benefit of decentralizing acute care. Since introducing urgent care centers, unnecessary ER visits have dropped, wait times are down, and patient satisfaction has improved. The PHCC's goal is that no Qatari resident should be more than a 20-minute drive from an urgent care clinic. Health planners in neighboring Kuwait and Oman are now studying Qatar's model as they consider establishing similar urgent primary care hubs. It's a reminder that sometimes small neighborhood clinics can have a big impact on the overall efficiency of a country's healthcare delivery. UAE Academic Clinical Partnerships. In the United Arab Emirates, efforts to develop local healthcare talent took a leap with a new academia clinic partnership. The Sheikh Khalifa Hospitals Network, a group of 4 government-run hospitals in the Northern Emirates managed by Pure Health, has signed an MOU with Ras Al Khaimah Medical and Health Sciences University, RAKMSU, to provide advanced clinical training for medical students. It is the first agreement of its kind spanning the entire Sheikh Khalifa Hospital network, which includes nearly 600 beds and 2,500 staff across facilities in Al Quwain, Ras Al Khaimah, Ajman, and Fujairah. Under the deal, RAKMSU students and trainees will rotate through these hospitals' wards and specialty clinics, gaining hands-on experience under the supervision of seasoned physicians. The partnership also entails joint research projects, faculty exchanges, and continuing education programs to keep practitioners up to date. UAE health leaders hailed this as a win-win. Students get exposure to real-world cases and modern technology, while the hospitals benefit from an infusion of young trainees and potential future hires. By nurturing homegrown doctors, nurses, and allied health professionals, the UAE is addressing its workforce needs and reducing reliance on expatriate staff over time. This model echoes successful academic medical centers abroad and is expected to be expanded. Talks are already underway for a similar collaboration between Abu Dhabi's Health Department and Khalifa University's College of Medicine. Ultimately, such initiatives will elevate healthcare quality by investing in human capital, ensuring the UAE's rapidly growing hospital infrastructure is matched by skilled national professionals to run it. Finally, we have population health management. Egypt, 100 Days of Health, milestone. Egypt's ambitious 100 Days of Healthy Lives campaign, 3rd edition, reached the halfway mark with astonishing reach. As of September 7, day 54 of 100, the Health Ministry has delivered over 77 million free medical services to citizens across the country. This massive nationwide effort, launched July 15, brings healthcare directly to the population via primary care units, mobile clinics, and public hospitals. The services span preventive screenings, blood pressure, diabetes, hepatitis C, etc., chronic disease checkups, maternity and pediatric care, surgeries, and dispensing of medications, all free of charge. On a single day, September 5, for example, nearly 400,000 services were provided, including tens of thousands of preventive screenings and over 149,000 therapeutic care services. The campaign also integrates health awareness. So far, outreach teams have educated hundreds of thousands of people on topics like nutrition, family planning, and hygiene. Officials highlighted that by saturating communities with services, the initiative is catching many health issues early. For instance, thousands of previously undiagnosed diabetic patients are now in treatment. The Deputy Prime Minister noted that beyond the impressive numbers, the campaign is a practical step toward universal health coverage, UHC, proving Egypt's public health system can scale to meet population needs when properly mobilized. With several weeks still to go, the 100 Days campaign is on track to far exceed its targets, potentially topping 120 million total services. International observers from WHO praised the campaign's scope and have suggested it could be a model for other developing nations seeking rapid UHC gains. Gulf countries, data-driven care transformation, health systems in the Gulf Cooperation Council, GCC, are rapidly embracing population health management, PHM, approaches to tackle the region's chronic disease burden. This week at a regional health economics forum, analysts presented early outcomes from PHM pilot programs in Saudi Arabia and the UAE. In Saudi Arabia, the Ministry of Health's new model of care, which organizes providers into integrated clusters accountable for community health, has started to yield tangible benefits. One cited example, at King Fahd Medical City in Riyadh, an AI-driven chronic disease management program stratified diabetic patients by risk and coordinated interventions like home visits and telecoaching. The result was a 33% reduction in diabetes-related hospitalizations over a year. Similarly, Saudi's introduction of DRG, bundled payments, has incentivized hospitals to focus on quality and follow-up, not just volume. In the UAE, officials noted that the National Health Information Exchanges, Abu Dhabi's Malafi and Dubai's Nabid, have greatly improved data sharing, allowing epidemiologists to map trends and target high-risk groups for screening. For instance, Dubai's PHM team used data to identify neighborhoods with low colorectal cancer screening rates and then ran mobile screening caravans there, significantly boosting early detections. GCC countries are also leveraging wearable technology and patient apps to gather real-time health metrics, feeding into big data platforms for analysis. With substantial government investment, Saudi now allocates 5.7% of GDP to health, UAE 3.5%. The GCC is poised to lead in PHM innovation. Experts cautioned that success will require cultural shifts, moving from episodic sick care to proactive prevention, but there's strong political will to do so. The consensus, PHM is no longer just a buzzword in the Gulf. Bahrain, national insurance and PHM synergy. In Bahrain, the imminent rollout of the Sahati National Health Insurance is set to bolster population health management efforts. Under Sahati, every citizen and resident will have a basic insurance plan guaranteeing essential services, with the option to seek care in either public or private sector. This reform, part of Bahrain's National Health Plan 2016 to 2025, is coupled with the deployment of advanced PHM tools. The government has established a national electronic registry of patients and is implementing integrated data systems to continuously monitor key health indicators. For example, data from clinics, hospitals, and pharmacies will feed into a central analytical dashboard. Health managers can use it to identify trends like rising hypertension cases in a particular locality and respond with targeted interventions, e.g. a blood pressure screening drive or health education campaign in that area. The Supreme Council of Health noted that a key focus will be on chronic disease management. The top drivers of morbidity like diabetes, heart disease, and asthma will have dedicated registry-based programs ensuring patients get regular follow-ups and adherence support. Additionally, Bahrain plans to align provider payment incentives with PHM goals. Once Sahati is active, insurers will reimburse more for preventive services and chronic care coordination, rewarding outcomes rather than volume. In short, Bahrain is creating a virtuous cycle: insurance reform enabling more access and choice, digital integration enabling smarter care, and PHM strategies enabling more efficient, preventive-focused use of resources. Health leaders believe this triad will greatly enhance the kingdom's ability to improve population health metrics, like reducing obesity and smoking rates, which are still high. If successful, Bahrain's model could be a template for smaller nations seeking to leapfrog to a modern, PHM-oriented health system in one concerted push. Let's summarize this week's review. This week's Middle East health news paints a picture of a region in dynamic transition. On one hand, we see bold reforms and innovation driving healthcare to new heights. Gulf states are aggressively modernizing health policy, from Saudi Arabia's insurance mandate and Oman, UAE school health programs to Bahrain's upcoming national insurance, all aiming to boost efficiency, access, and quality. Technology is a linchpin of these reforms, Saudi harnessing AI for faster services, Bahrain investing in a unified e-health network, and Dubai hosting a global health tech expo, exemplify the digital transformation underway. The region's life sciences and biotech sector is likewise gaining momentum. Qatar and the UAE are partnering with pharma giants to host R&D, Israel and Saudi Arabia are achieving firsts in organ regeneration and biotech strategy, and local manufacturing of vaccines and biologics, Egypt, Saudi, Jordan, is becoming reality. These advancements show Middle Eastern countries not just adopting but contributing to cutting-edge medical science. At the same time, formidable public health challenges persist, especially in conflict zones. The Gaza Strip's deepening famine and rare disease outbreaks offer a sobering counterpoint to high-tech ambitions, a humanitarian catastrophe demanding urgent relief even as neighbors like the UAE and Egypt send aid convoys. In Yemen and Sudan, surging cholera reminds us that basic health security can collapse without stability and support. These crises have galvanized a sense of regional solidarity, evident in joint efforts such as Arab Health Day's calls for unity and the cross-border cooperation to assist Gaza and Syria. They also underline the importance of population health management. Prevention and strong primary care are crucial not only for chronic disease, but for resilience against outbreaks and emergencies. Looking ahead, the convergence of wellness promotion, PHM, and digital innovation is poised to reshape Middle Eastern healthcare in the long term. Governments are increasingly proactive. Egypt's sweeping 100 Days campaign and the GCC's data-driven care models should help bend the curve on chronic diseases and improve pandemic preparedness. There's a cultural shift toward viewing health as a collective responsibility, from Saudi's quality of life initiatives encouraging exercise to the UAE's community wellness events. Executives can expect continued heavy investment in health tech startups, telemedicine, and AI integration as the region strives to leapfrog into a new era of smart healthcare. In summary, the week showcased a dual narrative: on one side, bold initiatives and breakthroughs propelling Middle Eastern healthcare to new horizons; on the other, ongoing battles to secure fundamental health needs in areas of crisis. Navigating these dual realities will require sustained leadership and collaboration. However, the momentum seen in policy reform and innovation provides cautious optimism that the region is building a stronger, more equitable health future, one where lessons from both adversity and triumph will shape a healthier tomorrow for all. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening this week.